As your partner in health, we want to make sure you have the resources to live the healthiest life possible. Part of that includes keeping you and your information safe and secure from healthcare fraud, waste, and abuse. Here's a closer look at how fraud impacts you, what we're doing to prevent it, and ways you can protect yourself. Healthcare fraud occurs when someone intentionally misrepresents services. This includes the nature of service, the date of service, as well as the identity or eligibility of an individual. These fraudsters or bad actors try to harm others for financial gain or to receive ineligible services. In the U.S., it's estimated that up to hundreds of billions of dollars each year are lost due to healthcare fraud. Not only does that lead to higher health insurance premiums and healthcare costs, but it can also expose you to unnecessary medical procedures, out-of-pocket costs, and put your personal information at risk. But that's where the Special Investigations Unit can help. The Blue Cross and Blue Shield Federal Employee Program Special Investigations Unit is dedicated to protecting our members and the program from fraud, waste, and abuse. With backgrounds in healthcare, data analytics, law enforcement, and compliance, they use their diverse skills to investigate, identify, report, and prevent healthcare fraud. SIU uses data to identify fraud schemes and trends around the country. Another important part of what the Special Investigations Unit does is educating FEP members about the different types of healthcare fraud. Here are some of the most common fraud types and schemes that you should be aware of. Billing for services not rendered, misrepresentation of services, misrepresentation of dates of services, unbundling of services, upcoding of services, double billing, billing for medically unnecessary services, ineligible dependents, provider shopping, phantom billing, and submitting false statements. Another scheme is identity theft. This is when someone tries to steal your personal information, like your social security number, date of birth, and member ID card. Unfortunately, fraud schemes are always evolving, but the SIU team monitors schemes and trends in order to protect our members. Healthcare fraud can have a significant impact on your life, but there are things you can do to protect yourself. Think of your member ID card as valuable as your debit or credit card. Keep it in a safe place and never share your member ID card information with anyone except your doctor, pharmacy, or other trusted healthcare providers. Some fraudsters like to call people and request their insurance information for record purposes. In exchange for your info, these individuals promise a free service or medication. Never provide your personal or payment info to unknown individuals for services that were not provided to you. If you ever receive a prescription in the mail that you didn't order, do not use it. Contact your healthcare provider immediately and ask why you received it. Some fraudsters are taking advantage of the latest ways to get care. Be wary of telehealth consultations that provide unnecessary and costly medications like topical creams or ointments. Instead, rely on a trusted board-certified provider for telehealth services like Teladoc. One of the most important things you can do to protect yourself is to carefully check your explanation of benefits, or EOB, when it arrives. Review it for accuracy by making sure the medical services listed were received. Consider asking your pharmacist for a list of prescriptions filled at the pharmacy for your review. When in doubt, if something doesn't seem right, it probably isn't. Always be vigilant and mindful of your private information. If you feel that you have been a victim of healthcare fraud, call the FEP Fraud Hotline at 1-800-337-8440. You can also call the OPM OIG Hotline at 1-877-499-7295. We're committed to protecting our members and the program against healthcare fraud, waste, and abuse. When it comes to keeping you and your information secure, know that we're with you every step of the way.